This presentation will be covering the topics of disruptive staff and workplace violence. Workplace violence, including harassment, is more common in healthcare than other work areas. Harassing behaviors in the workplace include bullying, lack of civility, and horizontal violence. When exploring how to handle behavioral issues among staff, there are two different types of employees: marginal employees, who are unable to reach a certain level of competence, and disgruntled employees, who are always complaining. Substance abuse is an increasing issue in society, nursing included. Early recognition and prompt treatment are essential. Workplace violence is any violent act, physical, verbal, or written, such as threatening actions or body language, verbal or written threats, physical attacks, slapping, hitting, shoving, kicking, beating, rape, and homicide. Preventing violence in the workplace includes implementing zero-tolerance policies, being educated on and reporting the warning signs of violence, and implementing adequate environmental controls. When dealing with violence, early recognition is the best strategy. Verbal intervention is appropriate when the bullying behaviors are not physical or violent. If a violent or dangerous incident does occur, a post-incident follow-up is essential for the well-being of all involved. Examples of bullying include ignoring an individual or giving the silent treatment, engaging others in gossip, treating someone in a condescending way, dismissive body language such as eye rolling, ridiculing or using sarcasm, verbal abuse, isolating the victim, sexually harassing the victim, or engaging in physical attack. Bullying not only threatens the victim, but also poses the danger on the patient. Bullying can lead to decreased staff satisfaction and can also lead to absenteeism and a high turnover rate of staff. Bullying can occur online, over text, or in person. It can include verbal and nonverbal behavior, as well as the involvement of other individuals. The Joint Commission recommends zero tolerance for bullying. The American Nurses Association Nursing Code of Ethics calls nurses to create an ethical environment and a culture of civility and kindness, treating colleagues, co-workers, employees, students, and others with dignity and respect. Best practice strategies are implemented to prevent bullying and workplace violence and create a culture of respect by promoting the health, safety, and wellness of nurses. A lack of civility may not be as obvious as bullying, but can still endanger the patient. Examples of uncivil behaviors include someone who is rude, impolite, disrespectful, or generally ill-mannered. Aggressive behaviors include yelling, swearing, spreading rumors, or stealing or destroying others' property. Again, there must be a zero tolerance for lack of civility in healthcare, promoting a culture of respect. If a lack of civility does occur, the manager must intervene with verbal reprimand, education on appropriate and inappropriate work behaviors, as well as a follow-up with the individuals involved. Horizontal violence, also referred to as lateral violence, is the harassment between employees of equal rank. As the saying goes, nurses eat their young. Outcomes of horizontal violence include moral distress of the new nurse, emotional detachment from the workplace, a negative workplace climate, reduced satisfaction of the staff, increased stress levels, and ultimately the employee leaving the job. Nurses need a safe and civil workplace that encourages and supports them to practice to the full extent of their license. Provision 6 of the Nursing Code of Ethics states that nurses, through individual and collective effort, establishes, maintains, and improves the ethical environment of the work setting and conditions of employment that are conducive to safe, quality health care. The provision goes on to state that nurses are responsible for contributing to a moral environment that demands respect for interactions among colleagues, mutual peer support, and open identification with difficult issues, which includes ongoing professional development of all staff in ethical problem solving. Marginal employees are the employees that are unable to reach a higher level of competence that is expected of experienced nurses, no matter how often they are coached or disciplined. They are sloppy, have poor communication skills, or are inadequate in decision making. This type of employee may cause other employees to become discouraged as they try to pick up the slack of the marginal employee. These types of employees cannot simply be ignored. Managers must be persistent and fair in following the organization's procedures of progressive discipline and even termination if the behaviors continue. Disgruntled employees are the employees that are always complaining. Most of these complaints are directed against the organization, which can affect how others view the organization. This type of employee can affect the morale of the unit in a negative way. This type of behavior can be addressed through setting standards of performance for the employees, keeping behavioral notes about incidents of complaining, taking early and consistent action, and following up appropriately. As mentioned earlier, nursing is not immune to the increasing prevalence of substance abuse. Substance abuse poses a danger both to the impaired nurse and the patients. Signs of alcohol or drug dependency includes, but is not limited to, a recent decrease in performance of a conscientious worker, a decreased personal appearance, mood swings, depression, or suicide attempts, strong interest in patients' pain medications, frequent trips to the restroom, isolation, such as switching to night shift or eating alone, excuses for tardiness or inadequate explanations for absences, and difficulty meeting deadlines or schedules. Physical symptoms of alcohol or drug dependency can include shakiness or jitteriness, slurred speech, diaphoresis, an unsteady gait, nausea, vomiting, and weight loss or weight gain. Indications in the workplace of drug abuse may be things such as incorrect narcotic counts, frequent discrepancies or corrections in medication records, a high wastage of narcotics, or patients complaining that their pain intervention was ineffective. Early recognition and prompt treatment are essential. There must be a collection of the nurse's behaviors, including absenteeism and tardiness, job performance, physical symptoms, and complaints from patients and colleagues. The manager, administration, and Department of Human Resources must look at the institution's policies and procedures related to drug and alcohol abuse in order to find the appropriate resources for the employee. Resources include employee assistance program counselors, treatment centers, other recovering nurses, and Alcoholics or Narcotics Anonymous. Licensure laws may require a recovering nurse to have a restricted role post-treatment. Re-entry into the organization must be carefully planned out. Under the Americans with Disabilities Act, a recovering nurse is considered disabled because of their restricted activity, and their disability must be kept private. Workplace violence is any violent act, including physical assaults, as well as threats of assault, directed toward persons at work or on duty. As mentioned previously, workplace violence is more common in healthcare than in other work environments. Examples of workplace violence include threatening actions or body language, verbal or written threats, physical attacks such as slapping, hitting, shoving, kicking, beating, and even violent assault such as rape and homicide. Violence in healthcare also includes horizontal violence, which was previously covered in this presentation. Violence in healthcare occurs most often in psychiatric units, geriatric units, waiting rooms, and emergency departments. Patients who have suffered head trauma, seizures, dementia, drug or alcohol withdrawal, and homelessness may be more likely to be violent. Factors contributing to workplace violence can include understaffing, especially at mealtime and during visiting hours, long waiting times, overcrowded waiting rooms, working alone, inadequate security, poorly lit rooms, hallways, or parking lots, and places with unlimited public access. Consequences of violence in healthcare, particularly to the victim, include physical injury, temporary or permanent disability, psychological trauma, and even death in extreme cases. Workplace violence can affect others as well as the victim. It can decrease morale, increase the stress level of the staff, be the cause of mistrust in administration, and lead to absenteeism and high turnover rates of staff. To prevent workplace violence, the organization must set a zero-tolerance policy, cultivating a culture that is intolerant to violence, and setting policies to match this culture. A code of conduct must also be developed to specify which behaviors will not be tolerated and the consequences involved if a violation of the code occurs. Educating staff is another important step in preventing workplace violence. Staff should be educated on the warning signs of violent behavior and potential assailants, as well as conflict resolution and de-escalation tactics. Staff should be educated on the policies and procedures that are in place regarding violence in the workplace. If an incident does occur, staff should know how to report the incident and to whom, and what documentation needs to take place. Environmental controls can also be modified in order to prevent workplace violence. These include things such as adequate lighting, security devices, bullet-resistant barriers, particularly in the emergency department, curved hallway mirrors, escort services for staff, adequate staffing levels, and staff alerts about patients with a history of violent behavior, dementia, or intoxication, and the use of restraints or seclusion in appropriate situations. Despite all efforts to prevent violence, it can still occur. If a violent situation does occur, there are a few ways to handle it. Verbal intervention is most appropriate when the behavior is not physical or dangerous. Verbal violence can often precede physical violence, so staff should be aware of how to reduce regression. It is important for staff to keep calm and get the person away from others. Nonverbal communication is also very important, such as the use of body language, distance, and silence. When speaking, keep your words clear and direct, use a soft, calm tone, keep a normal volume, and slow the rate of your speech. It is important for staff to be able to recognize the signs of escalating violence. These signs include things such as clenched fists, a blank stare, a fighting stance, which is pictured to the left, arms raised in a fighting position, standing close or advancing towards you, holding anything that can be used as a weapon, such as a pen, a heavy object, or an actual weapon, or intentional statements. If a violent event occurs, staff needs to be familiar with the policies of their organization regarding violence. In general, the staff must first and foremost protect the patients, visitors, and themselves. Security should be notified immediately. Never try to disarm a violent individual, but if the person is unarmed, recruit staff to help restrain the violent individual. This may involve creating a barrier between yourself and the violent person. Other dangerous incidents include infant abductions, bomb threats, and intruder alerts. Your organization should have specific policies related to these incidents, and it is important that you familiarize yourself with them. After a violent incident occurs, a post-incident follow-up is essential for the well-being of the patients, visitors, and staff involved. After the event, make sure everyone is safe and that treatment is provided to those who were injured. Complete injury and incident reports as appropriate, as well as involving human resources for the process of involving workman's comp if required. If security is not already involved, contact them in order to determine if a police report is necessary. Follow up with the injured employee at home to check in on their well-being and answer any questions they may have. Click the link to check out OSHA's tips on how to prevent violence in healthcare. If a violent situation does arise, it is important to know how to defend yourself. Here's a short clip provided by the Wall Street Journal in 2014 with Tim Larkin, who is the founder of Target Focus Training, teaching us 3 defense moves that everyone should know. The textbook offers strategies for verbal intervention in violent situations. First, you should state the issue at hand. Tell the person how the problem is affecting the unit or organization. You should also state what you would like to happen and ask if the person is willing to comply. You should then schedule a follow-up with this person. Also included is a chart provided by OSHA on job-related violence in healthcare. While under 20% of all workplace injuries happen to healthcare workers suffer 50% of all assaults. Visit OSHA for more information.